next speaker هيبقى الدكتورة نيفين عبد العزيز. دكتورة نيفين طبعا هي لاب دايركتور، هي ماستر ديجري ولاب دايركتور في مركز دار المرأة. دكتورة نيفين ان شاء الله هتكلمنا على الاير كواليتي انسايد IVF Lab والسيفتي اوف ذا بيشنت اند ستاف. اتفضلي دكتورة نيفين.
تحياتي حضرتك يا دكتور محمد وتحياتي لكل الدكاترة اللي معانا وأساتذتنا. And I have the honor to represent part of the assert document concerning running the IVF Lab during COVID-19 pandemic. The topics I'm going to cover are the air quality in the IVF Lab and safety and prevention measures. It is known that normally the IVF Lab is equipped with HEPA filters to filtrate particles in the air and filters to remove volatile organic compounds. And this filtration system is usually fitted with an HVAC system to provide a healthier condition for the embryo development. But the HEPA filters can only be effective against filtration of relatively large particles that is approximately 0.3 micrometer in diameter. While we have the coronavirus between 70 to 90 nanometer in size, so the HEPA filters have no rules in the filtration of the viral particles. And in the light of this, we found that extra HEPA filtration is not recommended during this period because the opposite can theoretically be true, as any kind of air recirculation in the lab can cause resuspension of the viral particles according to the airflow direction and velocity. Also, we know that the normal level of relative humidity in the IVF lab between 40 to 60%. And luckily, some published data support that this level has the lowest viral viability on the surface. So we recommend to keep maintaining the relative humidity between 40 to 60% and to use non-humidified incubator. We know that poorly built or maintained HVAC system can be a source of contamination, and COVID-19 is no exception. So we have to make sure that the system is properly installed, maintained, and the filters are replaced in time. While there are so many recommendations to convert the pressure of the operating theaters and intensive care units to negative pressure like the isolation hospitals, there is no clear evidence for the safety of negative pressure on the culture system in the IVF lab. So we believe that turning off the system entirely during the working hours only may be safer. The second part concerning safety and prevention measures. We first have to educate patient and staff, and this is through clear written instructions to be given to the staff members, patients, and how to behave inside the IVF facility during the time of the pandemic. The lab also must have a clear written plan to deal with different situations, emergency situations, and the lab director must ensure that his staff completely comprehend and can perform those plans effectively when needed. Of course, we must practice the social distancing protocols, and this is by restriction of movements of patient and staff in, out, and around the facility, restriction of accompanying persons to one with each patient, and it is advised to separate the lab members to 2 or more rotating teams with no overlap or meeting. Teams can work sequentially, or one team can work for 14 days and then they self-isolate themselves, and the other team can take their duties. Although we must practice the social distancing protocols, but we still need to communicate. So we must have an updated lab phone tree. Meetings between the lab members should be held more frequently through web-based applications to review working protocols and update plans. For the IVF facility, as well as especially the lab, must supply or provide sufficient supplies of hygiene, cleaning supplies, and sanitization. All the staff members have to learn and follow the WHO hand hygiene steps. The lab members also must follow the general recommendations for healthcare providers and use the recommended protective personal equipment, and to ensure enough stocks of them. The recommended PPE include cleaning scrubs, overhead gloves, and a surgical mask. Of course, there must be rigorous hand washing before entering the lab, before wearing, and after removal of the PPE. And the used PPE must be discarded in biosafety containers. Persons who wear contact lenses in the lab are advised to replace them with medical glasses or wear a protective glass. Each IVF facility must provide or set up an area for the daily screening or evaluation. The area must support the social distancing protocols and provide hand hygiene facilities, and staff performing the checks must wear the recommended PPE. The team is encouraged to arrive to the facility earlier for the evaluation, and they are encouraged also to report distantly any symptoms they develop before they reach the facility. The evaluation includes daily temperature measurement and periodic examination, blood examination, including CBC, CRP, ESR, and serum ferritin. These reports of evaluation should be under strict surveillance and continuous revision, while elder staff, pregnant women are encouraged to follow the recommendation of social distancing and stay home. In case that any of the lab member develop fever or any symptoms that is indicative of COVID-19, or if they have been in contact with suspected or infected case of infection, they are encouraged to self-isolate for 2 weeks, or they are encouraged to inform the responsible authorities to take their advice while keeping the facility updated with their health condition. They can only return to work after confirmation that they are free from the virus shedding, and the entire facility has to go the most aggressive sterilization protocol, and a special interest must be given to the area that that person was usually accessed. If the infection is confirmed, then we have to communicate with the authorities to take the advice, either with complete shutdown or aggressive sterilization, and with assigning the duties to the backup team. The patients also must be informed and counseled and encouraged to take their own decision, either to cancel the whole cycle, to continue with the backup team, or to complete the cycle in a collaborative facility. Thank you and stay safe.
شكرا دكتورة نيفين.